Operating in the brain is technically challenging for a number of reasons. The brain does not allow for any margin of error. There's a time point in many surgeries when you decide, is removing those last 3 cells going to help the patient, or is there a potential to hurt the patient? If you take out all of the tumor and you leave the patient without the capacity to interact with the outside world, then that doesn't provide much of a benefit to the patient. The key is to balance the benefits and the risks, and we're well equipped to do that.
This is the first step of the library prep.
We work together in a multidisciplinary team and make the best possible treatment decision, which is tailored to that individual patient. Many tumors are benign and can be sometimes just observed or treated with a straightforward surgery. Others are more malignant and require systemic treatments such as chemotherapy and radiation. We've now figured out the right patients for the right procedure, and the outcomes now have improved significantly.
Doctor, can you rotate the patient a little bit for me, please?
We do craniotomies where the patient is awake while I'm operating on the brain. I'm interested in doing that type of awake mapping, both for strength and also in patients who have tumors that affect their language. And we've been able to keep the patients safe by having them speak and stay awake and be able to completely resect the tumor and keep all of their language function intact. Something that would not be possible without having good stereotactic intraoperative guidance with MRI scans. We've been able to develop imaging actually in the operating room to identify the cells that are abnormal that you would want to resect. We're also going to be using an intraoperative MRI scan such that as soon as we feel like our tumor resection is complete, that we'll be able to immediately visualize if we have achieved the extent of tumor resection that we think we have. So we're on the forefront of applying those techniques to make a real difference in patient outcomes.
Just call back. I can see you any Monday or Friday.
One of the things I find inspiring about doing this is the interplay between research and development and actually applying new therapies that make a big impact in patient care. One of the important ones has to do with tailoring therapy based on the mutation profile of patients' tumors. Also, there's a new technique for minimally invasive access to tumors, specialized retractors that are very small that I can use to get to the deeper part of the tumor. The key thing too is to not sit and feel content, but to always feel that perpetual drive to come up with the next best treatments.
You want taller?
Yeah, definitely. How are you doing?
I am doing super.
Doing well?